Part 9, Shock. Welcome to the lesson on shock. In this video, we will discuss causes, signs and symptoms of shock and how to take care of an individual experiencing shock. Shock can be caused by overwhelming infection, blood loss, severe allergic reaction, severe dehydration, or heart problems. When blood flow is significantly reduced, the body does not receive an adequate supply of oxygen and shock occurs. Individuals experiencing shock may lose consciousness or fail to respond. Signs and symptoms of shock include poor skin color that is pale, gray, or bluish, dizziness and lightheadedness, nausea or vomiting, behavior change such as agitation, confusion or unresponsiveness, and clammy skin. When you are to take care of someone suffering from a shock, you should first call 999/EMS. Then, help the individual lie down and elevate their legs. Cover them with blankets to keep them warm. Be prepared to perform CPR. And stay with the individual until help arrives. This concludes our lesson on shock. Next we will review controlling bleeding.